We're going to look at our doctor's orders. We're going to gather our equipment, which is a Foley catheter closed system. We're going to knock, come in, introduce ourselves to the patient. Hi, Mr. or Mrs. Jones. I'm Adam. I'm going to be your nurse today. We're going to insert a Foley. I'm going to wash my hands, and then we're going to get started, okay? If you have any questions, we'll explain it as we go along. So I'm going to come over and wash my hands, raise the bed to working levels, making sure that the other side of the bed, that the rail is up. And then we're going to look at Mrs. Jones's wristband here and ask Mrs. Jones her name and ask her to give us her date of birth and say thank you very much. Sounds good. Now we're going to do a Foley. This is so you don't have to worry about getting up and going to the bathroom. Some of the medications you're on, you would ask about medications, why they have maybe an incontinence problem. And that's why we're going to insert the Foley today. Okay, so it's not a big project, but it is sterile, so I have to do some gowns here, or gown up with some gloves, and then we will start the process. Okay, any questions? Cool. So now we're going to go ahead and we're going to do a diamond on the female. We're going to do pericare if required. Okay, then we're going to go ahead and open up our sterile package over here, our sterile field. So I'm going to go ahead and open it up. Keep in the bag should we need it, but since I just ripped the whole thing, and we would have a little garbage can. Let me grab that. Got our sterile package here. So we're going to open up our sterile field away from us. So we got one out, and you have 1-inch borders that are going to remain contaminated at all times. Okay, so we're going to move that over just a little bit. And we're going to open that up. It stays open. Again, staying at the 1-inch border there. Okay, then we're going to grab our, do I have sterile gloves in there? So we're going to grab our yellow, or our blue mats here. And we're going to lay it down so the shiny side is down. Okay. And then we're going to open up our sterile gloves here using sterile technique. Making sure that our cuff end is down. Got our right side here, so we're going to open it. Okay. And we're going to grab our right hand here with our non-dominant hand. We're going to lift it up away from our body. Slide our hand in. It ripped, but we'll consider it still sterile. Now we're going to take our other one. We're going to go away from our body and around. Keeping our thumb away, picking it up. And sliding our hands in here.
Well, I just wanted to see it because it ultimately
Here.
Yeah.
Okay, these gloves are a little small, but we're still going sterile here. Okay, then we're good. Now we got our hands up and away from us at all times. Then we're going to grab our little thing there that we don't need. We'll just get rid of that. And then we're going to grab our field, making sure that we are inside our 1-inch borders here. We're just going to pick it up and we're going to move it down to the patient. Is that okay with you, Mrs. Jones? Sounds cool. So we're going to pick it up and bring it right down here. We're going to float the boat. So we're going to take the boat out here. Okay. And then we have our urine cup. We're just going to take that out and set that over there if we need it. We're going to take off our plastic.
All right. Excellent. So we don't need skin.
Okay.
Most we need is foam.
We're just going to drop that in the garbage. And first for me, I'm going to go ahead and take my betadine or my hydrogen peroxide and spray it in there.
That's in the
Now we're gonna
garbage.
take our gel, or actually our lubricating gel. We're gonna open that, and we're gonna spray that. And we're gonna throw it in the garbage. And now we're gonna test our catheter.
I don't know what this.
Again, my hands are away from me at all times. We're gonna insert it, twisting it on there nice and hard. Make sure it stays.
So does that plug into there to make the noise?
And then we are going to inflate it slowly to make sure you don't have any
What this
leakage.
plugs into is, and it's possible they don't realize it for this.
And as you can see, there it is. And you want to make sure you get it all in there. And then we're going to bring it back out.
So now I'm looking, this should have been in there, this is pulled out.
Okay, so my hands are sterile now. But now, since I'm going to get ready to start doing the actual cleaning of the vagina, the left hand is going to be dirty now once I start to touch her and hold her labia open. Okay.
See?
That is just a little bit closer. Okay, so this hand here this hand is going to be sterile, and this hand here will be dirty. So we're going to go ahead and take the labia now and hold on to it. We're going to open it up. We're going to take our sterile tweezers and take one of your swabs and go down.
I would probably still try to take
Okay.
it place here.
And then you're going to bring it around and throw it out, which will simulate. And you're going to take your next one and do the side. Okay, and out and drop it. Then one on the left side, out away from your sterile field and drop it. And then we're ready to go. So we're gonna, and again, I'm not letting go of her labia at any time. So I'm gonna go ahead and move my pack forward here. Lubricate with the actual gel. Again, still never letting go of my hand, the dirty hand on the labia. And now we're gonna ask her again to bear down and insert.
You still want to look for a replacement for this, or what do you?
It'd be nice if I actually had some lubricant on there.
And you insert it and you say, until you see
Okay.
urine.
And I
then-
see urine, so now I've seen urine, and now I'm going to go ahead and insert 1 to 2 inches farther. And in this case, we're gonna go 2 inches. Okay, now I see urine, so I'm gonna let go of my dirty hand here and hold on to the catheter. Okay, and now I'm gonna go ahead and inflate the ball. Okay, and I'm injecting the full amount here. And now I'm gonna hold on to it and advance it up. So this should be holding in there now, and I'm gonna let go. Okay. And now we're done with the sterility. We're gonna pull to make sure it doesn't come out, and it doesn't. So now we have our catheter inflated. If we needed to, we would go ahead and collect a urine sample here at this port. We would use a sterile needleless system, and pull it out from there. If you have more than 750 cc's, you would go ahead and clamp it off at one point, and that way you prevent bladder spasms. And then after 30 minutes, you would come back and actually take out the remaining urine. And to secure this, what you would do is tape this to the side of the leg. So since we don't have 750 cc's, we're going to go ahead and take this and tape it to the side of the leg, giving her a little bit of play in the catheter itself. And then we would take our little hooks. So this is taped now. And we're going to take our little hooks that hang on the side. We're just going to bend them like that. And then we would hang it on the side of the bed. Okay? And that's it. Then your catheterization is complete. And then to take it out, what you would do is come back, take your bag off from the side of the bed. Actually, you could just leave it down there. But you're going to take the tape off. Again, you're going to expose her. And then you're going to come back and you're going to actually take out the water. And you want to make sure you got the 10 cc's out that you're going to be putting in. Okay, and you'd want to hold on to that just while you're doing that. Okay, so you got the 10 cc's that went in, and then you're just going to pull it out.
We are now the official distributor.
And that's it? You're fully cath. Good job, Mrs. Jones. Any questions you may have? Now, you're gonna have to go to the bathroom on your own.